Well, good morning, everyone. This is Kim Kinnaird with CORNerstone, and we have as our special guests today, Dan Rapp with the Ohio Farm Bureau and Vince Sowell, who's with Anthem, and they're here to present what's new and improved about the Ohio Farm Bureau Health Benefits Plan. If you currently have business with the Ohio Farm Bureau Health Plan, this change takes effect on 7/1, July 1st. And we're really excited about some of the changes that you're going to see. I think it's going to simplify the administration in a lot of different ways. I'm going to turn it over to Dan. He's going to talk a little bit about the health benefit or the Ohio Farm Bureau, and then Vince will take over. And then I'm just going to jump in with watching for questions that you guys might have and any CORNerstone specific information that needs to be conveyed. So with that, Dan, if you want to introduce yourself and talk a little bit about who you are, and I'll advance the slide.
Well, thanks, Kim. My name is Dan Rapp. I'm the Senior Director of Health Services Development for the Ohio Farm Bureau Federation. And in Farm Bureau, we've been engaged in the health services market really since the 1940s with our members, and almost every year with different products and services since then. For our members to utilize. A little bit of background on the Farm Bureau. Our mission is working together for Ohio farmers to advance agriculture and strengthen our communities. And our vision is to build a strong Ohio farm and food community. You know, we value integrity and honesty. We value grassroots involvement, which includes having our members engaged in the board of directors of this health benefits plan, as 6 of the trustees on the plan, all 6 of them are employers that participate in this group and help give us feedback and direction on where this should go. Promoting agriculture, of course, member advocacy, whether we're at the county level, working at the state level, or at the national level, lobbying on behalf of our members' interests. And teamwork with great partners like CORNerstone and all of the agents that have helped us put this product out there. A little bit, I get the question a lot on what is the ag economic sector that we're targeting. And this was really put together by some research at The Ohio State University identifying the ag economic sector. And the last time that it was updated, Ohio's ag and food production cluster plus restaurants and bars accounted for 1 in every $13 of Ohio's gross state product and 1 in 8 jobs in Ohio. And when we're looking at who might be eligible to participate in this plan, the cluster employs a little over 400,000 Ohioans in jobs across the state that we would look at, be focused as part of this plan. The agriculture and food production cluster is, very important to Ohio's economy and add $20 billion to the economy through purchases and additional inputs. Kim, if you want to advance the slide.
Oh, come on. There we go.
There we go. So this graph just gives you a little bit of an indication of a visual, if you will, of what does the agriculture and food production cluster look like. And I'm going to start up at the top with the farm input sector. And as you're thinking about that sector, that is any industry, any business that is providing inputs to the farm for production, whether it's seed, whether it's fuel, etc., all those things that go into farm inputs. And then obviously we have the farming sector, the actual production that's going on all over the state. Then once the product leaves the farm, it's heading towards some type of a processor, whether it's a canner, a dry processor, some other type of processing related to that food and fiber product is being done. Those are part of the sector. Then you get into all of those jobs related to wholesaling and retailing those products across the state, and then delivery right into the consumer through bars and restaurants, also eligible under the under this health benefits plan for the employees. Go ahead and switch, Kim.
So what I threw in here were some of the member benefits.
We have,
sorry.
no problem. We currently have about a little over 80,000. We have 80,201 total members across the state of Ohio. And our category of active members, which are directly engaged in agriculture, is 68,382. And one of the reasons they join is access to many of these different member benefit programs that they can participate in. We've categorized them in equipment, travel and entertainment, nationwide insurance, and different home and business benefits. When an employer comes onto the health benefits plan, every employee that enrolls becomes a member, and each employee is eligible for any one of these discount programs, whether they're looking to buy a new Ford truck, if they'd like to take a nice trip to Kings Island or Cedar Point, or make the annual run down, like I like to do, down to Pigeon Forge to Dollywood. Great place to go visit, and discounts available there. Another one I like to point out under home and business is our Member Savings Advantage, and that program is a telephone app, and it has probably 50 to 60,000 different businesses that have many discounts in the different communities that you might be visiting, where you can show your phone and maybe save 10% on a pizza at Marco's or something like that. It's an excellent program. I think
those change every day, right, Dan?
Yes, they do. Yep.
Yeah, so there's different deals every day. It's really nice benefit.
I think that pretty much wraps up what I wanted to hit on briefly, and just thanks again, Kim and CORNerstone, for having us part of the program.
Great, thank you. So I'll start here and then turn it over to Vince. The Ohio Farm Bureau funded or set up this MEWA several years ago. And in the past, you may have somebody call you and say, well, I've had Ohio Farm Bureau and a grandmothered plan. It might be an individual policy. So they do have a grandfathered, I think, individual plan. But this MEWA, this group plan, was started, I want to say, maybe 2017. And we got involved, I think, in late 2017, 2018 in promoting this with our brokers. It's for, well, one of the things that we've liked about the Ohio Farm Bureau is that the renewals are fairly stable. You know, they've seen less than 5% for the most part. There have been a couple of groups that, you know, got slightly higher renewal increases, but for the most part, the block has been very, very stable. And the other interesting thing about it is at the time there weren't a lot of options for sole proprietors, and we were getting a few slots that we could fill each year. So they can go down to a business of one, but I wanted to point out that right now there are no sole proprietor slots available. But as the block grows, and we believe that, you know, with Anthem as the administrator and the network and the underwriting partner, that is going to change, especially down in, you know, Southwest Ohio, where Anthem has such a strong presence and, you know, stronger network discounts. And so once that becomes available, we'll send announcements out and make sure that you're aware that we can go down to one. Do you want to cover the rest of this slide, Vince, and go ahead and jump in?
Yeah, I'll definitely do that. So good morning, everyone. As Kim mentioned, my name is Vince Sowell. I am the account executive for Anthem Small Group in the Central Ohio area. You might work with one of my peers, Nancy Kazenko in the north or Kathy Shiplett in the south. So I'll just kind of touch on a couple things here. You know, as Kim mentioned, it is a self-funded medical plan for, you know, the OFB members. You know, In addition to the financial protection, the health plan offers competitive rates through a self-funded arrangement, fixed predictable monthly payments. We have about 9 plans that we're offering right now. We are looking to change that for 2022. As Kim mentioned, we have our broad Blue Access network, our national Blue Card network. Since Blue Cross and Blue Shield, our parent company, is located within every state, we have the ability to offer coverage in all 50 states for all of our members. Our RX formulary, protection of our, from financial liability should your business leave the plan. And then last but not least, our wellness programs that guide and support employees' total health, which we will see a little bit later. So when we take a look at it in an eligible employer group, they must be headquartered in Ohio. Of course, they must be in the agricultural economic sector, and that is determined by SIC code. So we do have a list of all the eligible SIC codes. If you do need that list, obviously you can reach out to Kim for that list. They must be an employer, which is defined as a business that is actively engaged in a full-time enterprise that has a legal capacity to sponsor a group health plan on behalf of one or more common law employees. They must be a corporation, LLC, partnership, or sole proprietor. Again, as Kim mentioned, and as we will see at the bottom here, our total sole prop membership cannot exceed 10% of the plan's total membership. At this moment, we are not accepting any sole props. As Kim mentioned, once we do have those open slots, we will send a communication over to Kim at CORNerstone, and then she will let you guys know we have those open slots available. The groups must employ on average no more than 50 total employees. They must maintain a minimum of 1 enrolled employee residing in Ohio. We're looking at 75% participation after valid waivers, and then no more than 50% can be 1099 employees with standard caveats. And then again, as I mentioned with the sole props here, they must meet certain underwriting requirements, and they must demonstrate they are working more than 30 hours per week. They must submit the cover page of the Form 1040 with the Schedule C, or the combination of the Form 1040 with the Schedule F and Schedule SE as proof of sole proprietorship status. That is the only documentation that we can accept for that sole proprietor. And then again, I'll mention it one more time. We are not accepting any sole props at this moment because we have exceeded that 10% of their total plan membership. And you probably will hear me mention that one more time throughout this presentation. Just want to make sure you guys understand.
I added that in. I get that question a lot.
So when we take a look here, again, effective 7/1, the Ohio Farm Bureau Health Plan is being transitioned from MMO to Anthem. So here, in the next couple of weeks, we are matching MMO's 2021 plan designs and coverage with some exceptions that we will see in the next couple of slides here. All of our plans are calendar year based. And again, as Kim mentioned, this MEWA was established in 2017. And then last but not least, of course, the groups must be in a qualified agribusiness, which is pretty much farm to table. So as we look at our plan designs for the remainder of this year, again, we are using the same plans that MMO has. So we have these 9 plans listed here. Some things that we want to point out, our HSA plan deductibles are the same as the out-of-pocket max. And so there's going to be no extra cost share or cost sharing after the deductibles are met for our members. Also, our primary care and specialist office visits have the same copay for all of our PPO plans. Our ER facility under our PPO plans is just a flat $250 copay. The out-of-network deductibles and out-of-pocket maximums are 2 times the network deductible and out-of-pocket max. Our out-of-network coinsurance for our PPO plans is 40%. And then on our HSA plans, it's a 0%. And then last but not least, our $6,750 and $7,000 deductible HSA plans do not meet the minimum value and fail Medicare Part D credibility. So again, just wanted to point that out. So as we take a look at it, some additional plan details, the good thing about moving this over to Anthem is that we have the ability now to offer our foundational health and wellness package that we'll kind of see in a couple of slides here. If you're familiar with our MEWA product or our ACA product as well, this foundational package is what we're offering for those products as well. So we are excited that we have the ability to offer that for our Farm Bureau members. We have our essential 4-tier formulary. We have our optional mail order pharmacy through our PBM IngenioRx. And then our OFB health plan groups can elect or non-elect to use our ActWise banking integration. So our ActWise HSA banking is available, and that is housed through PNC Bank. So again, our groups have the ability to elect to use that ActWise platform, or they can use the bank of their choice. And then last but not least, this is my favorite part. This is the best thing to talk about, but our members have the ability to use our Smart Shopper program. If you're not familiar with our Smart Shopper program, shame on you. I think this is the best thing that Anthem has rolled out in the last couple of years. Just a quick note on the Smart Shopper program. This is where we have the ability to pretty much give our members money back when we steer them to incentivized locations for certain procedures and services. So anything ranging from annual blood work all the way up to a knee replacement, our members have the ability to earn anywhere from $25 up to $500 when we steer them to those, lower cost incentivized locations, still preferred providers in our Blue Access network. So they can either, go online to shop those services, or they can work with a customer service rep, which we definitely recommend them doing. But again, that Smart Shopper program is one of the best programs that we have here at Anthem. If you need any additional information or any marketing flyers, reach out to Kim or myself, and we can definitely provide more information for that.
Yeah, Vince, if I can jump in on the Smart Shopper, we did a webinar on this a couple weeks back, and they did a demo of the Smart Shopper tool. There's roughly, I want to say 42 different procedures that this incentive is available to members. And so we have those flyers, and you don't have to contact me, just contact your normal CORNerstone rep. They can get that information to you. And I think we recorded that particular session. So we'd be able to send that training if you wanted to kind of demo the tool. And also, can I point out too, on the pharmacy network, Anthem rolled out a tiered pharmacy network, I think, earlier this year. That's not in place for the Ohio Farm Bureau for the rest of 2021, correct?
That is correct. We are using our national formulary for the remainder of 2021. And then, as you mentioned, starting in 2022, we will be switching to our RX Choice tiered network, where you're pretty much looking at 2 different levels of pharmacies. Your level 1 pharmacy, which would include, CVS, Walmart, Costco, Sam's Club, Giant Eagle, Kroger. Those would be at a $10 cheaper copay compared to your level 2 pharmacy, which would include Walgreens, any Walgreens owned pharmacy, Rite Aid, and then a lot of your local mom and pop pharmacies as well. And then of course we do have a list of all the pharmacies in Ohio if needed. So you guys can make sure that you're, relaying that correct information over to our members.
Okay.
So as we move forward, we have some unique coverage rules. So, with the OFB Health Plan, some products, were originally defined by MMO. And so, again, for the remainder of the year, we will be, covering autism services up to the age of 21. All gene therapy is excluded. And then again, no pharmacy tiering for RX benefits. So again, as we just mentioned, we will use our national retail pharmacy network for the remainder of the year. And then come 2022, we will be switching over to that RX Choice tiered pharmacy network. And then we also have some changes to, be consistent with some of the Anthem standards. So we will be removing the pediatric vision benefit. We also have a slight difference in the covered oral surgical and TMJ services. So effective July 1st, the following are not covered oral surgical services. So any extraction of the teeth, surgery for impacted teeth, and other oral surgeries to treat the teeth or bones and gums directly supporting the teeth, except as listed in the Anthem benefit booklet. So through June 30th of this year, coverage is provided for the removal of the bony impacted teeth as described in the MMO benefit booklet. And then also effective July 1st, the following specifically is excluded from coverage. So any fixed or removable appliances which move or reposition the teeth, fillings, or prosthetics for treatment of TMJ. And then last but not least, elective abortions, gender reassignment surgery, reversal of involuntary sterilizations due to illness or injury, and reconstructive surgery to correct significant deformities caused by congenital or developmental abnormalities, illness, injury, or an earlier treatment in order to create a more normal appearance will not be covered. I'm sorry, will be covered. My apologies. It will be covered. And on this next slide here, as I've mentioned, we have the ability now to offer our foundational well-being package for these Ohio Farm Bureau members. So as we take a look at it, again, if you're familiar with our MEWA product, a lot of these are already, things that you should be familiar with. Our 24/7 nurse line. So our members have the ability to chat with the nurse 24/7. We have our condition care program, our Sydney Care. So of course we have the ability to now offer our Sydney mobile health app, which is, that artificial intelligence app that we've been talking about now for the last couple of years. We have the ability now to offer that for our OFB members. Our NICU case management, our AIM clinical review program, health assessment, and as you can see, a lot more. And then as we take a look at the network, this is again something that we're very excited that we can offer our Farm Bureau members. So we have our broad Blue Access PPO network. In Ohio, we have more than 1,500 primary care doctors. We have nearly 44,000 specialists. We have more than 300 hospitals in the state. And then across the country, again, we have the ability now to offer our Blue Card national network covering members in all 50 states. We have the ability now to offer 95% of doctors nationwide, more than 96% of hospitals nationwide, and approximately 66,000 retail pharmacies. And then as we take a look at the specialty side, any dental, vision, life, or disability coverage currently with MMO will stay in place. Anthem's full suite of specialty products can be quoted and added to the group with the same group number as the medical product. For any existing and transitioning groups, coverage can be added beginning on August 1st. Some of the benefits of placing specialty with Anthem, this is some of the things we've been talking about over the last couple of years, is we have the ability now to offer one ID card for our members. So I think everybody, remembers years ago when you went to the doctor or to the dentist or maybe the eye doctor and you had to, sort through your wallet or your purse trying to find that ID card. No longer anymore. So now we have the ability to offer one ID card with all lines of coverage for our members. We have one website for our members now to access and for our groups to make any changes, in which we'll kind of see a little bit later. Again, one enrollment platform. So for our groups having the ability to enroll a member for all lines of coverage, it takes about 2 to 3 minutes, if that, making it easier for our groups and you as a broker to get that information. Of course, we have our low rates for our OFB members. And then as we take a look at the network, in Ohio, we have more than 1,700 vision providers, and we have more than 4,000 dental providers. And just a quick note on the dental side, as of October of last year, Anthem has the largest PPO dental network. So again, when we can add those, things to our members, it's kind of a no-brainer to get that specialty with Anthem, making it easier for our members.
If I can jump in, we did get the shelf rates for groups that have 10 or fewer employees. So we will have that available here shortly and be able to share that with you if any of you are interested in that. If the group is over 10, they like to quote it because they can get more aggressive than maybe the shelf rates are set up to do. So talk to your CORNerstone rep for that. Then we're going to talk about what to expect once they move to the Ohio Farm Bureau.
Perfect. So as we take a look at the billing, EFT is required. Again, I want to mention that one more time. EFT is required as we transition to Anthem. The initial invoices will generate around the 10th of each month, and accounts are drafted on the 1st of the month. Now, if that first falls on a holiday, that draft will be on the next business day. Payments will be withdrawn automatically from the bank, again, with that EFT form. If there is a debit block service on the account, we have our ACH ID provided here. We haven't run into this situation that often, but again, if needed, we have that here.
If
Our
I
groups
can,
will receive, yeah, go ahead.
can I jump in and talk about EFT being required? Some groups may object to having a draft pulled from their bank account to pay their premiums. But one of the things that I point out to them is this is a self-funded plan and they need those premium payments to pay claims. It's not like you're floating on Anthem's dime here. It's a fund just for the Ohio Farm Bureau membership. So this way they don't have to chase their money. It helps keep the cost down if they don't have to worry about who's paid their bill and who hasn't paid their bill. There still will be issues where maybe somebody doesn't have enough in their account. That happens all the time. But that's one of the reasons why a lot of these self-funded products require EFT. So that's just something that a change that I think is actually a good one. It's not always easy to get the group to accept it, but it is required. So I just want to throw that out there. Sorry, Vince.
No worries. Thanks for the comment. So as we keep moving forward, the groups will receive 2 invoices. They'll have one for their medical premium, and then they'll have a separate invoice for their Ohio Farm Bureau membership dues, which are currently at $6 PEPM. If the group has any specialty products with Anthem, that will be an additional invoice. Now, all specialty products will be on one invoice. So again, in the event that group has medical, dental, vision, life, and disability, they would be looking at 3 invoices. Again, and then last but not, I'm sorry.
No, you go ahead.
Oh, okay. And then the amount billed for membership dues is based on the enrollment for that effective date as it is listed, recorded in Anthem's system on the date that bill is generated. So if if that group has 6 or let's say 10 members, they're going to see that invoice for their product dues at $60. If it changes to 11 the next month, it'll go to 66. So that's kind of how that works.
So one thing that I would remind you is that membership due. So when you join other MEWAs, you are going to pay a fee usually to join a chamber, and chambers often only benefit the employer. They might, maybe the sales reps get some networking opportunities, but this is something where when you pay these dues, it actually benefits every member covered under the plan and the employer. So they can get discounts for the things that they're normally buying across many, many categories. So I think that's one of the distinctions of the Ohio Farm Bureau Health Plan versus other MEWAs.
Perfect. And then here we have our online enrollment via our employer access portal. So I mentioned this a little earlier, that our groups and our members had the ability to use this online portal. So our employer access portal is the preferred communication channel for the member enrollment changes. In addition to enrollment changes, our groups have the ability to review and print their invoices. They can view their plan and benefit details. They can view and download the group's summary plan descriptions and annual HIPAA notices. And then they have access to Time Well Spent, which is a turnkey wellness communication toolkit. But then they can also, download new ID cards, or, maybe one of their, members of that group lost their ID card. They can send a new one to their address. So it's a very intuitive tool that, the groups have the ability to do a lot on there. And then in regards to the registration, we have the link here, employer.anthem.com with the backslashes here. The groups, we definitely recommend them getting on here, registering for the portal. All they'll need is their group number. They'll need their zip code, and they'll need some general contact information for whoever's going to be the site administrator. It's a very easy, probably takes about 1 to 2 minutes to get registered on that portal. If the group does not wish to register, that's fine, but we definitely recommend them having access. And then also you as a broker will have or can have access for your group as well. This will be initiated by an email that'll be directly sent to that group contact. They will either grant or deny your access. You'll get an email back saying that you have been granted or denied that access. From there, you'll be able to go online. And if you are the one making those changes, you will have the ability to do so through this online employer access portal. And then as we take a look at COBRA and state continuation, Anthem recently rolled out this MEWA.io platform probably last year in July. And this platform, assists with a lot of things. So it helps with the streamlining the termination process by verifying termination just to ensure that our members are offered the appropriate coverage options through COBRA or state continuation. It'll notify the group who qualifies for Medicare primary of any Medicare eligible employee, and it will help facilitate the online completion of that SEE package. So how MEWA.io works. So we will process a file every Monday for those new terminations or any members over the age of 65 from the previous week. On Tuesday, you as a broker will receive an email listing your termed employees that need to be validated or any Medicare eligible employees for any of your groups. The group contact will also receive termination verification request and Medicare package for any Medicare eligible employees. An employer communication is then sent, employer continuation reminder is then sent on business days 3, 5, and 9. Any unanswered request will result in a mailed letter to the group on the 10th business day. If the employers do not respond, no continuation notification will be going to the member. Weekly files resulting from the above will then be sent to My COBRA Plan, who is the exclusive COBRA provider for this MEWA. Once processed, the appropriate notices are then sent to members for COBRA or state continuation.
One note about ARPA, the ARPA subsidy for state continuation does not technically apply to this plan, and that's for groups under 20. If you have COBRA, you have to comply with the federal rules regardless of the way your plan is funded, but for state continuation, it does not apply to self-funded plans, so you don't have to worry about that on your smaller groups. Okay.
Perfect. So here we have just a quick slide on accessing benefit summaries and SBCs. We provided a link here just to make it a little easier for everyone to get that information. You can either copy and paste that plan name, or we have those 4-digit contract codes where you can pull up that information. The SBCs are required to be supplied to members 60 days in advance of this transition to Anthem. And then again, same with the benefit summaries. We provided the link here. And again, at the bottom, you can see just the easiest way to pull up these benefit summaries is, again, you can type in that 4-digit contract code, or again, you can copy and paste that plan name.
I believe we have all of the SBCs and the benefit summaries in our shop. So if you request those, we can get those to you if you need them for any of your groups.
Perfect. So as we take a look at the member prescriptions and the RX side, as I mentioned earlier, we are using the national formulary for the remainder of this year on the network side, but we are using our Essential 4-tier formulary. So we have that here available for you guys to use as a search function, the first link here. The second link is the PDF. Now, if you have available space for I believe it's about a 98-page document, go ahead and download that. It might take a couple minutes, but I definitely recommend using that search function. It's very easy. Type in the medication. It'll tell you which tier, 1 through 4 or non-formulary, which that medication would apply. Anthem does require the use of our network specialty pharmacy for our specialty medications. And those approved pharmacies are our Ingenio RX specialty pharmacy. And again, Ingenio RX is our new PBM. and then again, CVS specialty pharmacy as well. Some prescriptions may be subject to prior authorization, step therapy, or may not be on Anthem's formulary. The searchable list, which again is above, will link to any of these requirements, and you'll be able to see if any of that applies to those medications. Most providers file for authorization via Cover My Meds. Members are encouraged to ensure that they have adequate supply of maintenance medications before the effective date. So we always recommend, before a group would, transition over, or before a new group would enroll, make sure those members have enough medication, enough to supply them in the event that there are any hiccups as they move, over to Anthem, to, obviously avoid any disruption in their medication. So then,
Sorry about
I'm
that.
sorry, did you have some? Okay, no worries. So as we see here on the next couple of slides, what we're going to talk about now are some of the, embedded important programs that we have the ability now to offer our Farm Bureau members. So the first one is our Live Health Online tool. This is something that Anthem, I feel like, is the, the leading carrier in the Live Health Online market or space. If you're not familiar with our Live Health Online, this is the teledoc in a box service. On-demand doctors available 24/7, 365. Our members have the ability to access them via smartphone, tablet, computer, or any other tool or, service that has a camera pretty much. It does cost less than or equal to any office visit. So again, a lot easier when you're, sick, you're laying in your bed, just to open your iPhone or your iPad or any type of smartphone, talk to a doctor. They can prescribe you medication that you can go pick up at your local CVS or pharmacy. Just makes it easier. And at the end of the day, it's going to reduce the overall cost of care. It'll also include our behavioral health visits for any in-network licensed psychologist, therapist, and any board-certified psychiatrist. We also have our Future Moms program, which helps with any breastfeeding support, any lactation consultations, or any registered dietitian for personalized, postpartum nutrition and lactation support. And then last but not least, this is actually something very new that we rolled out this year. We have our sleep medicine, virtual sleep medicine clinic. You can say that, 5 times fast, but that includes our sleep medicine specialist and home sleep testing. So, I've never done it before. I don't know if you're setting up your camera and you sleep and the person watches you, but again, a very cool feature that we have the ability now to offer for all of our members. The next important benefit or program embedded with these products is our Anthem Health Guide. With our Anthem Health Guide, the employees can receive support and guidance by phone, mobile app, email, or online chat. The employees are connected to the right benefits and programs for healthcare needs, such as identification and placement into clinical care programs, reminders for preventive care, and much more. It's a relationship building and ongoing dedicated support as needed. Smart engagement technology for highly consultative, proactive member support. And then we have extended hours of operations and upgraded service levels. And then again, here we have that Smart Shopper program. I can spend hours talking about this, but again, this is the program where we have the ability to, give our members money back when we guide them to lower cost facilities. So again, it's an easy 3-step process. Step 1, they search they search for that procedure, whether that's online, speaking to our customer service rep, or online. Step 2, they had that service or that procedure at that incentivized location. And then step 3, 4 to 6 weeks after that claim has been processed, that member will receive a check in the mail anywhere from $25 to $500, again, just by going to that incentivized location. On this next slide here, we have our Sydney Health, which is again our Anthem digital platform, our artificial intelligence mobile app. With this, we have the ability to offer, a personal touch for our members. We have a personalized dashboard based on the members' plan, details, their claims, condition-based data, and identified health topics. We have a robust tool offerings to, help find care. So our members have the ability to use our Find a Doctor tool on that mobile app, online appointment scheduling. And again, they have the ability to use that online Live Health Online feature to talk to a board certified, doctor 24/7. We have timely, insight-driven messages sent based on the employee's health profile, built from clinical and claims data. And the cool thing here, we have our Anthem skill, which members can simply say, Alexa, ask Anthem to order a new ID card, ask Anthem to find a doctor, ask Anthem to refill my prescription, or ask Anthem to find out how close I am to reaching my, deductible or my annual max. So again, all these new features that we have the ability to offer with our City Mobile Health app.
Hey, we did get a question. It was actually texted to me. It didn't come through the system. The question goes back to billing. Are the membership fees going to be EFT as well? And I believe the answer is yes, but can you confirm, Vince?
It is yes. So again, they will be receiving a separate invoice to reflect those product dues. So again, the groups will see that. Obviously, it'll be a little bit less, than what they're seeing on their medical invoice, and the invoice will reflect as OFB membership product dues. So again, they will be receiving a separate a separate invoice, and that is EFT as well.
Gotcha. Thanks.
Awesome. And then here, okay, perfect. And then here we have our symptom checker and virtual text visits via Sydney Mobile Health app. This is something that we actually just rolled out this year as well. It's very cool. So our members can assess their symptoms, and they can start with our symptom checker, which they're pretty much answering a few questions about how are they feeling. They'll receive information and advice tailored to their gender, age, and medical history. The symptom checker was built with doctors and medical professionals. It intuitively uses the information that they provide to narrow down millions of medical data points and assesses their specific symptoms before they even see a doctor. So again, our focus is providing a better member engagement or a better member experience and trying to reduce that overall cost in care while also, closing those gaps in care. And so they also have the ability to connect with a doctor. The app can connect them with a board certified doctor through a virtual text visit right from their phone or tablet. Their virtual text visit offers a convenience and privacy of texting with a qualified doctor at any time, anywhere. They can also let you know whether you need an in-person visit as the next step. So again, if we can avoid our members from going into the doctor, spending that money if it's not needed, that's what we're trying to do here. So at the end of the day, we're looking to save money. The Sydney Health Symptom Checker is free. Why not use it? The virtual text visits cost less than most copays. So at $19 or less per visit, depending on the plan. So again, there are no cost share on the traditional PPO plans. And then on our HSA plan, the $19 copay applies until the medical deductible has been satisfied. So again, just to wrap up here, a lot of the important embedded programs that our members have the ability to use to enhance their member experience. So in the next couple of slides, what we'll kind of talk about is the underwriting, the eligibility, and the administration for the OFB product. So when we talk about the underwriting guidelines and the group eligibility, as I mentioned, is driven by that list of allowable SIC code. Again, if you need that list, please reach out to your CORNerstone rep. They can definitely provide that to you. Just a quick note on that SIC code. In the event that we have an SIC code that might not be on that list that you think should be eligible, we are working with that process to get those SIC codes eligible. We are working with Consoliplex and the OFB. It is pretty much up to them to make that decision. We have not worked out the seeing those SIC codes, but we are working on this. So I did want to let you guys know, again, in the event that there might be a SIC code that you think should be eligible for the plan that is not on that list, please send it over to your CORNerstone rep. They'll work with one of the Anthem reps, and again, we will partner with the OFB and Consoliplex to determine if that SIC code should be eligible for the plan.
Well, it's not an allowance for that SIC code, because there are exceptions. The exception process usually requires a letter from the group, a letter or email, requesting access to it and why. And there should be a reason, like, for example, they service the agribusiness sector. For example, we got a request for a trucking company that hauls grain, and we were able to get an exception for that group because they, I mean, almost exclusively work in the agribusiness sector. But any trucking company is not going to get approved. So it's on a case-by-case basis that exception gets made, and they want that documentation. Another example was we had an electrical contractor who owned a farm and was an OFB member, and then a portion of his business was outfitting dairy barns with their automatic milkers. So he was highly specialized, and so the Farm Bureau made an exception and allowed him to purchase the Ohio Farm Bureau. So that's kind of what you need to look for. The one that I see the most that doesn't normally get approved is excavation companies, because they're just moving earth around. Some of them might, dig trenches for farms, and they just need to make that case for it to be reviewed. So sorry, I needed to kind of put some expectations around that. And that SIC code list is fairly extensive. It's like florists and grocery stores and tobacco stores, and there's a lot of things on there. We actually have it in Excel, so you can kind of search through it if you want to look at your client list. The other thing that CORNerstone will be doing is when you submit a request, if we think it might be eligible for the Ohio Farm Bureau, you might get an email back from your CORNerstone rep saying, hey, this is eligible for the Ohio Farm Bureau. Are you interested in getting a quote? Especially if you've got medical apps already for other quote requests. So sorry, I'll flip that back to you, Vince.
No worries. Thanks for the additional comments there. So as you take a look at the group sizes, group size of 1 to 50 total employees. One enrolled can be a group of one or a sole prop, but again, as you see in the red, we are not allowing any sole props at the moment, since we are at that 10% of our total plan membership. So again, the plan will notify agents when the quoting is available, but again, it will be limited to a specific number of quotes. All final quotes will be medically underwritten. And again, the eligibility assumes the group will pay the OFB membership dues. And again, that will be billed by Anthem every month, and that's at $6 PEPM. And again, debited via EFT. And as we take a look on the next slide at the renewal, we're still looking at the common January 1 renewal date. So nothing's going to change there as we transition over to Anthem. Any group that is quoted or sold in the fourth quarter will receive 2 sets of rates. The annual benefit changes will apply January 1st. Aging adjustments will apply January 1st, and the trend will apply January 1st as well. There will be no factor changes made for any groups quoted October, November, December, and January. And then last but not least, we'll take a look at the quoting and new business. So CORNerstone agents will need to submit a quote request to their respective quote mailboxes via FormFire. Quote mailboxes or via FormFire. My apologies. So as we take a look at the quote requirements, we have the employer questionnaire. Now, this is not in FormFire. It's an actual Anthem form that must accompany the quote request. So again, the employer questionnaire is not located in FormFire. We will also require the quoting census, not least the medical member questionnaires. And again, it is highly recommended that these are not to be handwritten. Any handwritten questionnaire will often result in delays. FormFire Easy Apps or use of fillable apps is preferred. So again, we do not want our members filling these out handwritten. Obviously, if they need to, that is fine, but it will result in a delay. And as you take a look at the quote turnaround time, we're typically looking at 24 to 48 hours, standard quote turnaround time. During the peak season, you may see that, probably 3 to 5 business days.
And we say peak season, not fourth quarter anymore, because it seems like, April, May timeframe has gotten really busy. So, and the other thing I would throw out here is the OFB is one of the few options that will take a paper app. So, just some thoughts. If you have access to FormFire, you can get the apps from the members written and enter it for them. And you just keep a copy of their app for your records. But it's really easy for handwritten apps to be filled out incorrectly. And one of the nice things about some of these tools is that it forces people to answer things versus, leaving blanks and causing problems after the fact. And these electronically filled apps allow Anthem to use technology to, get a report of what the issues are on the plan versus having to look at every individual app and then try to decipher people's handwriting. So that's just my 2 comments on that. This employer questionnaire, we will send it out in a Monday Minute with the app, but what we may do is send it to you when you send in a quote for it. Just about every medically underwritten plan is asking for some form of a questionnaire. And at this time, we don't have it baked into our quoting template. I asked if we could, but Anthem wants it on their form. So it's just an extra step that'll be needed. And so just so you know, so if you plan on quoting a lot of this, go ahead and ask and we'll be sure to get it. In the meantime, I did get a question in here. Will quoting and underwriting and new sold group submissions be in FormFire? No, it won't run like the Anthem SOCA. The process is a little different with this. You basically are going to send your information to CORNerstone, to the CORNerstone quoting mailbox that you normally send it to, and then you'll get the rating factor, I believe, comes to us, right, Vince? And the
That
rates,
is correct.
yeah, so we download the rates and then send you the quote from there. And then another one said, can existing Anthem groups be quoted OFB Anthem rates at renewal? And I'm sure that's
The answer,
yeah.
yeah, I mean, yeah, as long as they're, again, we want to make sure that they're, an eligible SIC code. But from there, yes, they can quote it. If we need to have underwriting take a look, maybe it's a current ACA group or anything like that, we can have underwriting take a look and, they'll let us know at the end of the day, is this a good fit for them or not? So obviously first we want to make sure that they're an eligible group. And then from there, we can have underwriting check that they, would be a good fit for the OFB. If not, then, obviously you'd want to keep them, grandmothered or ACA or anything like that.
Sure. Great. Good questions. And let me go back to this. Okay.
So, and I think we actually just kind of went over this with the answer we just provided. So as we take a look at, receiving the final quote from underwriting, our underwriting team will review the employer and the member questionnaires, and we will determine that final factor, and then we will send that to CORNerstone or your CORNerstone rep. Underwriting will then enter the factor and send an email indicating that that final quote is ready to review. From there, CORNerstone will log into what we call our producer toolbox. They'll find the quote and they'll review, and then they will send to you guys as the sub agent. If that group decides to move forward from that final quote, the enrollment flow will then be started by CORNerstone.
And we may, we've got a sold case checklist. The first couple might be a little wonky as we learn this new process. It's different than how we do other things, although I think it's similar to how we do ACA sold case. So our team, we'll still need a lot of the information, but you won't have to upload these documents to FormFire. I know some of you are doing a happy dance about that. You will just send them into our new business team and they'll upload them into the producer toolbox and get this part started. But the the census information. That's what another good reason why you want to use a tool like a Form Fire, so that you can just download a census versus having to manually create one or update one with the final enrollment. Now, just one word of caution here. If there is a change in the quoted census versus sold case, you do have to have a relook at that. So as you know, if there's any change, the numbers can change, just like with any other medically underwritten product. Okay. Oh, and here's the list of the sold case items needed.
Yep, awesome. And as you mentioned, the quote and enrollment process is exactly what we're doing on the ACA side. So, you guys are obviously familiar with that, so it shouldn't be too much of a change as we, move this Farm Bureau over to that platform. So, with that, the enrollment requirements are listed here. We would need the completed electronically. It is completed electronically, and we would upload the document checklist automatically. So that would include the employer application, the OFB Health Plan participation agreement, the plan document, the final quote, which does need to be signed, the completed, and then now we have documents that are completed outside of the system and which would need to be uploaded. So we have the ARC, which is the annual census reconciliation form. Now, if you're not familiar with this is pretty much just a wage and tax form. We found a couple of years ago that a lot of groups just didn't know where to find it, didn't know how to access it. So this ARC form pretty much mirrors a wage and tax form that group is filling out. We also need that census, of course, the EFT form. We need the employee applications. And again, as Kim mentioned, if there are any changes to that census, from the quote to the enrollment time, we definitely need to make sure underwriting will need to review that. That factor could change. We can see that obviously if we take some unhealthy employees out of that equation, that factor could decrease, which is obviously an easier conversation to have with that group. But obviously if we take those healthy employees out of that equation, that factor could increase as well. And then a quick note here for sole proprietors only. Again, as we mentioned, tax documentation, we'll need that Form 1040 with the Schedule C, or again, the combination of the 1040 with the Schedule F and Schedule SE. If the group is enrolling into any ActWise, you're fine. If the group is enrolling to any ActWise platform, again, for the HSA banking, we do have additional information that they can fill out. And then if the group is enrolling into any life coverage, we do have our hold harmless agreement as well. And last but not least, we'll leave you guys with the good information here, which everybody definitely wants to know, the commissions. So again, broker distribution, select brokers are currently eligible to sell this right now. So again, with you guys being a CORNerstone subagent, you guys are part of the exclusive broker, market that has the ability to offer this OFB health plan. With that, our commission information, 8 PEPM on the medical, 10% for dental and vision and life and disability. Life, and then 15% for the disability. So again, pretty good commissions here for all of you guys. And with that, that's all we have. Kim, were there any other questions?
Nancy Kuzenko said that she wanted to clarify state continuation does apply to OFB just like it does to SOCA MEWA. What I was talking about was the ARPA subsidy, Nancy. So the ARPA subsidy doesn't apply to self-funded plans. So if you disagree, you can let me know. But I think if we look at our ARPA grid on the MEWAs, because they're self-funded, the subsidy did not apply on state continuation. So I think that's what I was trying to clarify there. So another thing that I want to point out is that Anthem's intent is to open up the Ohio Farm Bureau statewide to a lot more brokers. And you have a golden opportunity here to get this product in front of your customers before your competition does. So if you have not shopped the OFB for your groups, I think now is the time this is the year that you might want to bring it up to your prospects and your customers. because if it should be a great option for those folks. And I think you can see there were a lot of enhancements that Anthem brings to the table that were not built into the Ohio Farm Bureau plan before, like the wellness, that Smart Shopper app, and of course, in different markets, maybe, especially that greater Cincinnati area, there wasn't as deep a discount, so the numbers weren't as competitive down there. So I think this is a great opportunity to take a second look at the Ohio Farm Bureau and bring this up to a lot of your customers. So with that, I'm going to close it out. Dan, did you have anything else you wanted to add? Or Vince, did you want to add anything else?
I think I'm good to go. Yeah, nothing else to add.
Okay. All right, folks, well, we appreciate your time and thank you for joining us. And if you have any other follow-up questions or you need some materials, we have a new producer guide that'll be going out in one of the Monday Minutes here coming up. If you're not getting the Cornerstone Monday Minute, let your Cornerstone rep know. We'll make sure that we get your email address added to the distribution list. It's a great way to get notified of when we're doing webinars like this, as well as updates to products. And that will be the place where we indicate that we've got some sole proprietor slots. It's one email a week. So instead of getting emails every time we have a change or an update, the only other time we send a special notice is if something, really different has come up that we need to make sure everybody's aware of. So we appreciate your time. Have a great day. Talk to you soon. Bye now.
Thanks, guys. Have a good one.
Thanks. Yeah.